Good afternoon, everyone. I know it's 3:30. I'm going to allow a couple of minutes for everybody to transition into the call. While we're waiting for others to join, I welcome everybody to please put your name and organization in the chat.
This is a sound check, Dr. Thomas. Can you actually hear me?
I can hear you, Dr. Thomas. Thanks for joining. Can you hear me?
Loud and clear. I'm so used to Zoom. Thank you so much.
Absolutely.
I have a weak connection here, so I'll be off camera.
No problem. I know Dr. Slade Martin, she is teaching a class today and she's on her way, but she told me to go ahead and get the meeting started for her. So welcome everyone to the Prince George's Healthcare Action Coalition Health Equity Workgroup meeting. It's great to have you all on. For those jumping on, please put your name and organization in the chat as your introduction. And we have a nice agenda set up for today. We'll have possibly some county council updates, and we have a great discussion from Dr. Bauer with our Consumer Health Information Hub. And then we'll do a little bit of updates around the Health Equity Champions curriculum, specifically around implementation of the program. We'll move on to discussing member recruitment and engagement activities. And then finally move on to community announcements and talk about the next meeting. And here is our fearless leader now, Dr. Slade Martin. I will allow her to take over.
Yes, well, welcome. Hello, everyone. Let's see, as I look at what we're doing here. So again, welcome to our monthly meeting. It's good to see everyone here. Kim, where are we? Are we?
I've just, I had asked everyone to put their name and their information in the chat and just walked briefly through our agenda for the day. So I can move to the next slide.
Excellent, excellent. And I want to know if there are people who are new to our meeting, and if you'd like to introduce yourself. And Dr. Bauer, it's so good to see you here in the Health Equity Work Group. So nice to see you because you did so many things. So
nice to be back.
Yes, thank you. did we have someone introducing who may be new to the group? Or if there are people who haven't been to the meetings in a while, I was going to see if I saw one person that I was going to call out. But great to see everyone. And so I just again want to extend my welcome to the group, and I want to also acknowledge I don't know if the students from the Terrapin think tank are with us today, but just to acknowledge their participation in their work with the Health Equity Work Group. They're helping us do some really fantastic things. And we look forward to that engagement. I think we had, was it 40 people at our meeting in February? So hopefully we'll see some of those individuals and students join us today. But welcome everyone. And I think before I go, is Dr. Let's see, is Dr. Hancock with us? Yeah, Dr. Hancock will, when she joins us, Kim she can go straight in. I will also check, I wanted to see if I had my phone, but I will check to make sure I haven't, we may want to check emails also to see if she's reached out. She was trying to enter our previous meeting. And so we can go to the next slide. And I'll do a recap of the previous meeting.
Are you seeing the previous meeting recap slide?
No, I think we're seeing the Health Equity Work Group cover page.
I do not know what's, okay, here we go.
All right. And so we had in our previous meeting a really excellent discussion about the new Maryland dental plan for people with Medicaid and how they've expanded the dental services. So we had the Maryland Dental Coalition. They did a fantastic presentation and actually followed up and sent us some very helpful follow-up information and flyers related to the new services that are available. I was actually able to take that flyer to an event at the Central Union Mission the following day and share that information. There were quite a number of people interested in this new benefit. We also really got into more discussion about the Health Equity Champions curriculum and had breakout groups and discussed in more detail about ways that we can adapt the curriculum. And so we're preparing to send the notes from the various meetings we've had about the curriculum. And we're happy to say we're ready to turn those notes over to the students with the Terrapin think tank. We've met with the students and with their leadership, including Dr. Latouche Howard, and they are moving forward in developing the curriculum and not just the curriculum, but looking sort of overall programmatically at what we're hoping to do with the Health Equity Champions program. So we're excited about that. And so, Dr. Bauer, I know that you didn't want that long introduction, and I'm not. Look, after we had our quarterly meeting, look, I'm not going to be called out. We're just happy to have Dr. Bauer with us, and Dr. Bauer is an endowed chair and director of the Horowitz Center for Health Literacy at the University of Maryland. And we're so happy to have you because you really served us so well and continue to work with us as part of the Health Equity Work Group. So welcome, Dr. Bauer.
Thank you so much. And yeah, I just wanted to maximize, discussion time. I did not mean to call Dr. Little out in any way, shape, or form.
No, that was fun. That was fun.
So how many minutes do I have? I just want to make sure I stay on time here. Like 5 minutes?
Oh, you have more than that. You're welcome to
Okay, great.
Use your time fully.
Okay, great. Thank you so much. And so good to see you all. I've been off, like a lot of you, in the trenches doing the COVID messaging on a number of projects and kind of finally coming up for a little bit of air. So it's good to be back with you all. So I'm here today to talk about a new initiative that is legislatively mandated as of last year. So this is as a result of a bill in the Maryland legislature, HB 1082, that went into law on July 1st, 2022. And this is, I think, a very exciting development in the area of consumer health information, because a lot of us for a long time have been advocating for more plain language information, more information in various languages that are culturally appropriate. And this Consumer Health Information Hub is a way to kind of break through and I hope make some progress in that area. So in brief, what the law does is designates the Center for Health Literacy as the facilitator for creating and promoting more plain language health information in the state. And it's actually in 4 areas. So it's kind of like the health topic information, but it also covers safety information. So think like workplace safety, think traffic safety. There's all kinds of safety messages that we don't necessarily always think about under health literacy, but safety is an area. There's social services information, and there's also health insurance information. So the hub's mandate is really broad in a wide ranging topics. And so that's very exciting. The two key components are that state and local public agencies are supposed to use plain language information when they communicate with the public, right? So that part of the law is already in effect, and we're convening a work group of state and local agencies to begin working on that. And then the second piece is to begin to both disseminate and implement health literacy criteria, best practices, expand training opportunities that are in professional development opportunities that are available. And so that's really the law in a nutshell. It has a 4-year term on it. So this first year has been an unfunded year. There will be a little bit of funding that starts coming to the Horowitz Center as of this summer to expand these activities. And our goal is to really help build out this concept of a consumer health information hub over the next 3 years in partnership with all the local health improvement coalitions. Because I really see that this is a network that's already in place. We don't want to duplicate or go off and try and create something that already is a very robust infrastructure. And I heard Dr. Little say the other night that the coalition, the Prince George's Coalition, is over 400, members / organizations. And so that's a really great base to start with in the county. So I was very pleased to get a little bit of time on the agenda to explain the Consumer Health Information Hub concept. But I mainly wanted to, have a little discussion, particularly with the Health Equity Work Group, knowing that the work group's been very heavily invested in health literacy work for a long time. Start surfacing some of the ideas that you might have about the high priority topics that we should tackle, or activities that we should tackle under the hub. So yes, this is really just kind of a little bit of a listening session for me too, in terms of ideas. That I know we have a lot of concerns after, the the high point of the pandemic has eased a bit, what we've learned about health information creation and dissemination over the last 3 years. So hopefully that will also help us think about where we want this hub concept to go. So if I have a few minutes, I would like to just, solicit feedback and comments and some discussion on that.
Yes, and we had, I think, set aside at least 20 minutes or
Okay,
more
great.
for your discussion.
Excellent.
Is that a hand? Is that Kim? Is your hand up? Or
Yes, my hand is up. So I'm really curious, how can someone use the services of the hub? So if an organization had a message they wanted to put out, what would the next steps be to work with the hub?
Okay. So I think right now, that's a great question. And we're still kind of trying to figure that out. I think one of the missing pieces for a lot of organizations, and even state organizations that have more resources than, CBOs and smaller entities, is that there's no real infrastructure for getting consumer testing and feedback on materials. And I think that's where we're headed, but I don't know that we can stand that up right away. I think this first year is a lot about, first of all, finding out what kinds of criteria and best practices organizations are already using. So for example, on Monday of this week, I had the first meeting of this state and local agency work group that I referenced. And the Maryland Health Benefit Exchange, which is the state agency that, provides the Affordable Care Act health insurance plans, right? They already have a plain language checklist. None of the other entities that were in the work group did. So we circulated that MHBE plain language checklist to the other attendees. They're taking a look at it from their own agency's perspective. They're trying it out, seeing how it's working with their own materials. And then we're going to see, can we use that checklist as is? Do we need to refine it in some way? And that would be like that very early, like kind of low hanging fruit thing, because then everybody would have a common checklist to begin working from. So I think right now we're trying to focus on some of those products that could be like immediately useful to people. And then as I'm meeting with LHICs, with other organizations, kind of soliciting what are the other high priority things. But my feeling is that if we can figure out a way to stand up a consumer feedback loop for people, that could ultimately be very useful.
Thank you. And then for me, in terms of specific feedback from the health department side, the Office of Assessment and Planning recently finished up the community health assessment. I know one of our big tasks is going to be disseminating information from the community health assessment to partners, but also into the public. So I know it would be really important for us to make sure that it's not too too much data verbiage, and that we're getting that into a digestible format for the public.
Yeah, I met with the Midshore LHIC yesterday, which combines 5 counties. That's Dorchester, Kent, Queen Anne's, and I'm drawing a blank on the other 2 right now. I think Caroline and Dorchester. And like one of the requests was for templates, right? And so that could be something, for example, there could be, since everybody has a community health assessment and everybody needs to release that information to the public, that could be sort of one of the early wins too. It would be a template for communicating community health assessment information to various audiences.
Thank you. I love that idea.
great ideas. What are there other questions, other comments? I don't know if I can see the raised hands, Kim, but are there other questions or other comments that people have?
So also, Kim, one thing while we're waiting for other people to raise their hand, I'm planning on October 4th here in College Park to have an in-person networking hub meeting. So people can do networking, information sharing. We'll probably have a couple professional development activities. My guess is it'll kind of be from about 11 to 3, so people can come in from other places around the state and, not have to stay overnight. So yeah, if you guys could hold October 4th on your calendars, that will be one thing to look forward to, where we can do some in-person work as well on hub activities and resources.
Great idea. Sharon.
I just
Hey,
wanted to
Sharon.
unmute. Hi, how you doing? So you were talking about data, and I think that the use of graphics, like simple graphics, is really important, especially if we're talking about, diverse, multilingual target audiences. Not only graphic display of data, but also other graphics that can be used to convey messages. Sometimes I like the use of graphics, and sometimes the graphics are kind of silly or stupid, but or they're not inclusive. So trying to figure out, maybe some recommendations for use of graphics to convey messages.
Is that specifically for the sharing of data, do you think?
No, I think it's both. I mean, I think it's sharing of data, but I also think it's sharing of other health information. Particularly if you're looking at low literacy or language limited population, English language limited populations. I feel like graphics are really helpful, but they need to be appropriate and inclusive and not silly.
Oh yeah, yeah. Well, and I think that's why if we can find a way to stand up this consumer testing service, that will give us that kind of feedback from diverse groups of people, diverse audiences, to know, like, are there, I might have talked about this in the past. This goes back probably maybe even 15 years ago. There was a group funded by Robert Wood Johnson Foundation to try and come up with like some universally understood icons and graphics. And it ended up being a really small set of icons that were understood cross-culturally. And they talked, the people who did that project talked about that in terms of like, they were surprised about how challenging it was to come up with icons that had the shared meaning across different cultural groups. And so it is really important to know how people are looking at a wide range of graphics and what meaning they're attributing to those graphics.
Great. Thank you. Other questions or comments? I see Dr. Thomas with us today. Welcome to everyone. Good to see all in attendance. Other questions or comments? Just as you look at, disseminating information and getting the word out, I often think of a group that I sometimes assist with projects, and that's the African Women's Cancer Awareness Association. And one of the things I think they do really well is they trained a cadre of cultural ambassadors. So they have people who work with who speak a wide range of language, representing the African immigrant community, and also looking at some of the competencies that are necessary in those groups. How do organizations like that or initiatives like that fit into down the road in what you're aiming to do?
Well, I think, a lot of times we talk about what's lacking, right? We don't have enough plain language information, or we don't have enough information in languages other than English. But if there's groups doing a really great job already, right, like they should be our exemplars, I think we could also learn from them, right?
Mm-hmm.
So if they're a group that has, a model that other organizations should know about and learn from, I think the hub can also be a entity to help share. That could be, part of the best practice work, right, is finding those organizations that are doing a great job at understanding what kind of information is useful to different audiences, how to get it into their hands, and getting those feedback loops. Because I think, oftentimes we start, we start with the information product, right? Like, what's the information product? And we're going to get that created. And we might even have some dissemination strategies, but we don't necessarily have the feedback loops. We don't necessarily have the mechanisms for going back and making the information stays current and accurate and revising that. It's like a whole process. It's like, and I think one of the things that we can potentially help organizations with is they might do a good job on the front end, but they might not have all the pieces in place to kind of keep that going over time, to refresh and correct information, to update it, right? Because that's what we know is information, what we know about a topic can change, right? COVID reminded us of that quite vividly. So I think there's some things just in terms of how organizations produce information products that we could be helpful with too.
Absolutely. Great. Other comments or questions about the Consumer Health Information Hub with Dr. Bauer? Other thoughts or questions related to that?
So are you guys telling me that you think the health information environment in Prince George's is perfect? I mean, everyone's so quiet. I was like, what? We know that everybody's got their own little thing about what they would like to improve.
Yeah. And so if you're just joining us, this is a great opportunity to, share some of those health literacy questions or things that can happen with the Consumer Health Information Hub and this new law that is mandated. So
one other thing that I didn't mention is we also have to write an annual report to the legislature to talk about the progress on making more plain language, linguistically appropriate information available. And I see that as an opportunity to raise awareness with our elected and appointed officials on what we need to. So that's another thing that I think this coalition can be very helpful in thinking about is what, as I mentioned earlier in the week at the larger coalition meeting, we had a lot of money that was available because of COVID, right? There was a lot of money coming to not just health departments, but lots of organizations to do outreach and education and messaging. But that's not how it's going to be going forward, right? And so the question is, what kind of infrastructure, how did we end up building out some communication and information infrastructure because of COVID? But what are we going to do now going forward? And so I think having you all kind of think about and keep on your radar, what are the things that you either learned from COVID or are emerging in sort of this kind of new environment we're in that we should be raising awareness on with our elected and appointed officials, because that's the kind of stuff I would like to include in the annual report. So it's not just it's not just like what we did, but it should be forward looking and talking also about what needs to happen in the future.
Dr. Bauer, I have some feedback for that. So one of the big takeaways we found while putting together COVID vaccine clinics is that the media that was used for the messaging definitely had an impact on who we reached and how we reached them. So my specific example is we worked with the ad hoc vaccine planning group to put together a vaccine clinic at La Union Mall, which was primarily targeted or focused on populations either from an immigrant community or with Spanish as the primary language. So we found that a lot of the dissemination of messages happened either with in-person flyers or by word of mouth, as opposed to, I think we've moved into such a place where social media and internet-based information is the go-to. But I do think that there is still a place for kind of that boots on the ground or word of mouth information sharing. And I guess my follow-up question for you is, do you think technological barriers play into health literacy, or is it a separate thing?
Well, it's definitely part of it. And one of the things I've been, talking about in these conversations is just parallel to everything that's been happening on the health specific side is the state is also making multi-million-dollar investments in the digital infrastructure in the state. And there are not enough health people participating in those digital literacy conversations. And there's an office at the state level that is driving this broadband rollout and investment. And there was several $1 million that went to the cooperative extension group in the state to do digital literacy training. And so we should definitely be partnering with them, because I think, to your point, while digital has a lot of advantages, it's not the only way to reach people, right? And so we have to have, an all of the above strategy all the time. But we don't want groups left out. If there's money being spent on digital build out, we want to make sure that that build out is going to support the health infrastructure in our communities as well. And I am concerned that there's not enough health people in those conversations. And I think, because so often digital build out is either from an economic development perspective or education, right? Like K through 12 applications. And so I think that we do have an opportunity to speak up and talk about why the digital infrastructure in the state also needs to support health uses and applications as well. So I think that's a really important thing. And I'm happy to share information that I get about what are these digital literacy activities with the coalition, so that you can kind of think about where you kind of want to be involved going forward. But your point is very important. I think take advantage of the benefits that digital offers, but always supplement it with these other kinds of outreach, because we know in our own lives, we learn a lot from talking to our friends and our family and our neighbors, right? That's just how it works. So the idea that we're going to get everything we need from social media or some online news, source, that's not even our reality, right?
Absolutely. Yeah. Thank you.
Other questions, comments? We have any other perspectives or questions from health professionals who are all on the call?
Well, I was going to say, if you think of things afterwards, on the Horowitz Center website, we have a tab for the hub. That's where this image comes from. And we have a form where people can give us feedback and suggestions and things like that. So if you don't have anything on your mind right now, but think of something later today or tomorrow or, in the future, you can always go to our website and use our form and get in touch with us that way. And you can always email us at our healthliteracy@umd.edu address. We monitor that email box all the time.
Thank you. And thank you, Kim, for posting those links. Thank you,
Well,
Dr. Bauer.
Yeah, thank you for the time. And it's good to be back and seeing you all again.
Yes, really exciting information. We're looking forward to working with you. And everyone, make sure you have that October 4th date set aside. So thank you very much. Okay. I think I just checked to see if I heard from Dr. Hancock, and I don't, I have not. So we will go to the next agenda item. I do want to, I see a number of folks who've come in, and just to give opportunities to Dr. Thomas to see if you have announcements or any additional questions or comments. We see a number of people that have come in. Good to see Christine and all. So we're gonna talk some more about the Health Equity Champions curriculum. As I mentioned, we're working closely with the students at the Terrapin think tank in the public health area at University of Maryland at College Park. So thank you all again for the the great work you've done in contributing and giving feedback at different state throughout the last several months as we've talked about the curriculum. So we've put together information regarding key factors that we want to cover as we adapt this curriculum for adults who will be trained from different areas of the community, and really looking in many ways at grassroots engagement from the community. So we're turning that information over to the students to help us develop that program in a bit more detail. We thought it would be important, and I think Kim, if you can show some of those key highlighted points. We thought it would be important to have some discussion here to talk about what do we need to have in place to implement the program. Now, I will say that we have, through the work with the Terrapin think tank, we've started discussions on a partnership with the University of Maryland. And I might get it mixed up, but it's the public health department that Dr. Latouche Howard works with. And so we're looking at beginning those partnerships and relationships. And we also had, as Dr. Thomas has always offered, to prepare and look at ways that we can connect this program. And certainly as we look at continuing some of the work with health literacy to maintain that overall collaboration with what Dr. Bauer does as well. But again, formally, we have begun some discussions with Dr. Latouche Howard and the students of the Terrapin think tank. So what we thought was really critical is that we had some discussion, some brainstorming about where do we go from here? What are some of the key elements and factors that you see as important as we look at talking through what we talking through our next steps. And so I just want to open up the discussion in general as we look at implementation and realizing, we are a volunteer group. We are a group that we don't have the funding or structure. And so we are excited to have these relationships that we have built with the University of Maryland. And so I want to open the discussion first to begin. First, I want to make sure we have on record that I'm, to thank Dr. Latouche Howard and her students and the students in the program for stepping forward in assisting with the program in this way. And so let's start by saying, talking about what resources might we need to consider. We don't have to be narrow about we don't have to stay within these three boxes per se. But if you have just thoughts or ideas or questions about implementing this health equity champions program. And for those who this may be new to, it is a program in which we are looking at training a cadre of community members to focus on advocacy, health equity, health in all policy, advocacy, and policy, and moving that forward in engaging the community more on a grassroots level. So people can come from any sectors. We think a lot about, for example, the relationships that Dr. Thomas has developed with the barbers and beauticians. And we hope that some of those barbers and beauticians will participate in the program and serve as people who will work in the community in advocating for health issues and health policies in the county. And so in that context, I want to just talk about implementing the program and your thoughts on implementing the program. So don't all shout at one time, but let's talk about any of these three: resources, funding, collaborations that we need to take into consideration. Hands raised. Hello. Dr. Bauer.
Can you clarify, is the training going to be around advocating for like new policies and funding around health equity initiatives? Or for example, because here's what I'm thinking, you know, I see health literacy is part of any health equity model, right? And because we know there are information inequities, right? Information disparities. And so, for example, with these ambassadors, would one thing that they would do is they would help address these identify and address health inequities in the communities where they're working. Would that be part of the training or not? Or would that be something that's more just under the collaboration? Whereas, like, you know, the hub, whatever the hub's activities are, they would be interfacing with these trained advocates and ambassadors, you know, so that they understand like what health information is available to them and to their communities. Does that make sense?
Yes, and it's some of all of the above. And I'll ask, I think Christine Stewart was on, and I think maybe she might have dropped off. But so let me back up a bit, and Kim, you might be able to help. I don't have notes with me, but generally what we have been working on is this Health Equity Champions program or initiative. And with the Health Equity Champions, again, we would have representatives from the community. It might even be some people from businesses, from agencies, but kind of representing the all areas of the county. And those individuals would serve as people who would educate and work and interact with the communities in which they have contact or connection with, right? And they would focus on those 4 areas. So one, what we've done is we're adapting from the Project Share model that was done at University of Maryland, Baltimore County. And that model was more, as you know, was more focused on students and training students to go out. So what we've done is we've selected 4 primary areas that we would train participants in. One would be certainly looking at health equity and all of the definitions and health in all policies. And so people would have knowledge about those core areas related to health equity. And certainly a central thing is the whole areas of health literacy and all of the pieces related to health literacy. And then we would have the curriculum will focus on how we deliver the information, how we engage with the community, leadership skills that are needed, public speaking skills that are needed. And then the fourth area would be looking at promoting health and wellness in the community. And so under that, we focus a great deal under advocacy, policy making and discussions, how we would engage with legislators, understanding the legislative process in the county, how that connects to bigger pictures. So all of those things in a sense that you mentioned. There are others who worked with the discussions with the project, and you're welcome to jump in. But does that give you kind of a sense of the primary areas that we would focus on for these health equity champions?
Yeah, that was very helpful. Thank you.
Yeah.
And
so
just
that,
oh yes, go ahead.
Yeah, so that health literacy is, of course, just a central core part of that.
I mean, because as many of the members of this work group and the larger coalition know, it's often an equally important challenge that programs and services and resources exist, but usually they're not well promoted and people don't know how to connect to them, or even if they were interested, there could be other barriers. So I think there's, I think also promotion often doesn't get funded, right? So I think that is a funding question as well. It's like you've got to put some time, whether it's people time or other time, other resources into the actual promotional activities, because you could have the best developed programs, but if people don't know about them or don't, don't know how to access them, right? And that's often what we get called in to do, is help with that awareness promotional piece, because the services are there, but they're just not connecting with the people who could benefit.
Absolutely.
And then that causes, or at least contributes to, the health inequities, because there's a mismatch there.
Mm-hmm. Yeah, we end up not having the access for reasons of not having the information, awareness of the information. Sharon, I think I saw in the chat, Sharon mentioned recruitment. What are some other things? This is good. Thank you, Dr. Bauer and Sharon. What are some other things as we think about these things that we need to consider and where they may impact? Now, this is not normally a shy group. I'm not. We're I know it's the kind of the end of the week, but we're gonna really want to hear from you as we move this forward.
I can start calling people out. Well, I see some people from the OAP team that I think would probably think of some stuff, specifically where they work in, like, just evaluation of the program. So thinking of how do we know that the Health Equity Champions program is doing what we intended it to do?
We also had, I think, another some things in the chat with recruitment of presenters. Now, you all know I can talk for days, but I'm pausing so that we can give you opportunities to share some of your thoughts. Incentives. You know, I think when we think about funding, we often think about grants. Now, again, the goal of part of the goal of our group, as we talk about implementing, is we shape this and develop these partnerships and collaborations. Is to in some ways is to hand. I'm thinking to hand over, but maybe to be supportive in helping to develop grants that can fund and support the projects. And we've done a bit of that before in terms of writing grants. Again, we're not a that type of an entity. Other thoughts in terms of collaboration. Great. That's a good one. Thank you, Sharon. Sharon, you should just get on your microphone.
Yeah.
I know. I
You
talk
have
about
lots of good ideas.
dominate here.
I was going to ask Dr. Thomas, are you still on? Well, Dr. Thomas has been very instrumental in a program that I think is very interesting. It's called Legacy Leaders. Do you guys know about the Legacy Leaders program?
I believe, is that the one associated with the White House and some of the initiatives with the White House?
No, this is actually a program where retired persons who still want to be very involved in public affairs and active in public service, they go through a training. I think it's about the equivalent of about a semester, maybe a little bit shorter, in the fall leading up to the beginning of the legislative session. And then they get assigned to work with various legislators. And so the legislators get the benefit of, some very experienced and motivated and informed hands in their offices, but also it's a great, kind of civic participation opportunity. And that might be a very interesting model to kind of think about, is Legacy Leaders model that Dr. Thomas and Wes Queen have been doing for a number of years.
That's a great suggestion. In fact, I've never heard of that in that context, the Legacy Leaders. This is a really good. I've
presented to them, and yeah, there's people coming from all different backgrounds, a few from healthcare, but not everybody. So they're just people who are interested in still being in service and have an interest in helping advance public policies.
Yeah, talk about a great group to have as part of the Health Equity Champions. The other thing, since we're writing this down in terms of the collaborations, is also with the project that Dr. Thomas works with barbers and beauticians. Because again, we would look at drawing from those groups because of their direct interaction. Amber mentioned Dr. Askew's Meyer Foundation. Is that related to collaboration or funding?
Dr. Askew is a big champion for health equity. They have a lot of flexibility. He used to be the DCAO for Prince George's Health, Human Services, and Education. I know they're able to do stuff in the region, so I imagine if able, he would, work or maybe donate what they could.
Oh, wonderful. Thank you. Xerxes also mentioned health professional organizations. Deborah mention, and again, feel free you all to hop on your microphones. Deborah, but I don't mind sharing and reading. Uh, uh, Deborah asked, would we be interested in collaboration with organizations that target youth or young adults? Yeah, I mean, I think we're brainstorming, and so let's put those down, absolutely, because we want to reach as many people in as many ways as we can. I'm even thinking uh, as we look at is that with are you with the public school system? But looking at even if we look at the PTAs or whatever they're called now, but the collaborations with the PTAs, and also looking at them from a resource, not necessarily financial resource, but a resource serving as a resource where we can reach quite a number of community members.
I think that's actually a really great group. I had an example recently from my daughter's PTA group where the word equity was used not correctly. So I think that it's a really good learning experience to understand that, distribution of resources in a school can be equitable as well. So that could be a great champions group.
Mm-hmm. Yeah.
And I was also thinking just, when we think about health equity, a lot of times the focus is on, either older adults or seniors or older, again, seniors or older or the elderly. And so a lot of times we don't necessarily, develop programs that allow youth to be targeted as well, because sometimes, again, there's a big health equity issue there amongst youth. And so I thought it would be a good idea to think about maybe even within the champions, thinking about collaborating with some youth groups that we could use some peer-to-peer education. Maybe training young, youth groups that would be able to go out into the community because they're already in the community, and maybe like the Boys and Girls Clubs have leadership communities and volunteer organizations where they go out into the community and serve and volunteer. And so, like organizations like that would allow some peer-to-peer education among young adults or youth.
Mm-hmm. Great. These are great ideas. Keep the ideas flowing. Now, as we look at again, funding and as part of this implementation, looking at some of these specific foundations or organizations and potential grants that we can apply for. A lot of, when we look at this, we think about civic engagement and, policy. So there may even, sometimes the county council members have small allotments. And so if we ensured that there were people from their districts, they may be willing to provide some funding. Again, this would be it would not be managed by the health equity work group, but these are things that we can, certainly put forward as we're developing these ideas. Certainly, as we look at resources or collaborations with the civic associations or homeowner associations that exist throughout the county.
I'm sorry, I missed the last one you said about homeowners associations.
Yeah, sometimes civic and homeowners associations, they have different they sometimes talk about much more than just their, they are interested in the things that are happening broader community around them. I see Jean Drummond. Hi, Miss Drummond. How are you? Any thoughts from your angle, from your perspective? Or others? Let's see. Other thoughts? This is a good list. I mean, I think we've started generating a very helpful list. So before we close this out, any other thoughts on any of this? What do you think, Kim?
The one last thing that I've kind of been thinking of, and I know we might get some more support from the think tank group, but just housing the materials. So not only just, materials that we have, the actual, whether it be a recorded webinar, where would we put those? Is it going to go on a website? But also any resources that are developed for the program. So yes, I think housing, a location to house the materials.
And again, there has been some expressed interest, from Dr. Latouche's group to to support that. But we want to talk with, all of our various partners and how we move forward with that. And that's one of the reasons we're having this conversation about any thoughts that folks have as we begin to kind of really move forward to implementation. I have to say that we were probably not realistic about implementation. We had thought about doing a pilot program as early as January or February, but we really hadn't looked at the curriculum and realized the degree of work and energy that it would take to develop a viable curriculum, I think certainly as we look at marketing and issues related to marketing and recruiting and managing and all of those things. And so we have kind of stepped back and regrouped a bit in being realistic about developing a program and a curriculum that is meaningful, that accomplishes the goals that we have. And I won't even suggest at this point a date of implementation, but I think we're certainly moving in a good direction. Yeah. Anything else? Any other comments? Okay, well, thank you all for your input. Thank you for your engagement with this discussion. Do I take this too? Okay, so member recruitment and engagement. We just always want to put this up front. We are, really happy to see the participation and attendance today, and we want to just encourage everyone on the call and in the meeting to just share with them the wonderful things that are happening within the Health Equity Work Group. And you can tell by the scope of work we're doing and the opportunities we have. We certainly encourage anyone who's interested for you all to bring them along to meetings. There's much to be done. We are volunteer organizations, so would love to see additional people who are interested join us and be a part of this. And we're happy to add to the list. So please feel free to invite additional people and bring them along to our monthly meetings. Community announcements. Any announcements of upcoming meetings or opportunities?
Hey, Gia. Hi, this is Sharon.
Hey, Sharon. It sounds like you have your four-legged friend with you, and we don't mind at all.
Sorry about that. I've got a lawnmower in the back and a dog barking in the front. So, she thinks she can prevent the lawnmower noise. I just want to let folks know that there were a couple of pieces of legislation that just passed out of the General Assembly, out of the delegates side. And one is called the Access to Healthcare Act, which would expand the Maryland Health Benefit Exchange, extend it to immigrants in the state. And it passed out of the House side by, it was like the vote was 100 to 38. It was along partisan lines, but now it's going to go, it'll go to the General Assembly for a vote from the full group next week sometime. The other thing is there's another bill which was passed out of the Senate Finance Committee, which calls for a study of Medicaid expansion, and that would extend Medicaid to people regardless of their immigration status in the state. And there's several states that are doing this now in various ways, various different models. So it's asking that the Health Benefit Exchange look at and make some recommendations regarding models. So if people are really interested in advocacy, and it is time to really appeal to your delegates and your senators to vote yes on these, and to thank, I think it's Delegate Cullison and some of the others for their leadership in the equity area.
Fantastic. Thank you for sharing those with us. Isn't it comforting to be in Maryland? Thank you.
This is a moment in time in Maryland where the stars are aligned. So this is really very, very significant because you have a Democratic and mostly immigrant-friendly General Assembly, and you have a progressive governor. So, it's sort of like if it doesn't happen now, it may never happen, which is why folks should be really jumping on this advocacy bandwagon here.
Mm-hmm. That is helpful. Thank you very much for sharing that. Other announcements. I want to announce that the Prince George's County Community Advisory Group, which works with the Kimmel Center at Johns Hopkins, we have a guest speaker next week, Dr. Naeem Newman. He's a surgeon I think he's in Anne Arundel County. He's going to one of his passions is about nutrition and health and diet, and so he's going to be our guest speaker on next Thursday at 6 p.m. And you all are welcome to join us. I'll share information with Kim that can be sent out for those who may be interested. Any other announcements? Okay. Well, we are, I think we've covered everything. Our next meeting is Thursday, April 20th at 3:30. We thank you for your engagement and participation. If you have other thoughts or ideas on implementation or other thoughts or ideas for Dr. Bauer's program, please let us know and send that forward. So thank you, everyone. And you are actually getting 20 minutes of your time back. We appreciate you. Thank you.
Thanks, everyone.
Thanks.
Have a good one.